The Health Data Collaborative is an excellent example of collaboration. Even before COVID-19, health systems were burdened by data gaps that made it difficult to monitor the SDGs. In Tanzania, for example, a recent study found that a healthcare worker will spend 65 hours completing duplicate registration forms for a single disease. This is precious time that should be spent treating patients. The Health Data Collaborative was created to reduce the burden by bringing together tools, technologies, and partnerships. It's a foundation for promoting data as a global public good and reflects our shared values of trust, transparency, and accountability for results.
Welcome to the Health Data Collaborative Leadership event, discussing the health data driving the Sustainable Development Goals and defeating COVID, accessing progress through partnership. Please welcome your host, Executive Director of Communications at the United Nations Foundation, Catherine Cross.
Thank you, Bernard, and we look forward to hearing more from you during the next panel. First, however, we'll be hearing from Mr. Bana Bhakta Dakal, the Honorable Minister for Health and Population in Nepal.
Thank you, Catherine, for moderating the event and inviting me to speak. Dear Dr. Tedros, Director General, WHO, Honorable Minister of Health, Assistant Director General, WHO, all the event participants for different countries and institutions. First, I would like to thank Health Data Collaborative and WHO for giving me an honor of opening the ceremony and delivering the message to the event participated by global health leaders, which is a good forum for expressing our solidarity and partnership for better health data at all levels. The event will provide a platform for health partners to share and exchange views in the area of health outcome and impact monitoring and improving the health systems. Globe is now united together to respond and overcome the COVID-19, unprecedented in the history of global health. Though this pandemic has posed serious threat to all the aspects of human life, it has also provided opportunities for improving the health information system and offering digital solutions. The event with main theme on health data, driving the SDGs and defeating COVID, accelerating progress through partnership is timely and rational. We acknowledge health data as global public goods, helping us for measurement of health outcomes, setting evidence base for planning and support, knowing the communities left behind. The current pandemic situation has made us realize the need of preparedness for developing better information based to respond efficiently. This is also a good opportunity to renew the political commitment and raise advocacy for data and digital efforts linking to COVID-19. response with HDG Global Action Plan. I would request to widen the collaboration vertically and horizontally to distribute the benefits to global community and set sustainable resource mobilization mechanism for better health data. I wish fruitful outcome of this event. Thank you. Namaskar.
Thank you, Minister Dakal. You mentioned solidarity and partnership, and those will indeed be the main themes that we'll be hearing about today. So let's get to it. Let's turn to our first panel. We're honored to be joined by an esteemed group of leaders today operating at the very epicenter of public health in government and in civil society. I'd like to welcome you all and turn first to the Honorable Minister of Health in Zambia, Chitalu Chilafaya. Minister Chilafaya, in Zambia, you've seen tremendous progress in your health sector with support from better data and your own health dashboard. Can you tell us about Zambia's progress and the digital challenges that remain?
Well, thank you very much, moderator, and I recognize the representative of DG Tedros and all distinguished honorable cabinet ministers and my colleagues on the platform. Zambia, under the leadership of His Excellency President Edgar Chagwa Lungu, has embarked on a transformational path in pursuit of universal health coverage. Now, information management systems are pitched extremely high. They're a top priority in our health system strengthening agenda. It states again that data management systems form a fundamental cog in our health system strengthening path. Data is important in our planning, in our resource targeting. It's important in monitoring key public health programs such as maternal and child health programs, TB, malaria, and HIV, including NCDs. Further, data information systems are key as we talk about public health security. Surveillance is heavily dependent on collecting data and collating it and analyzing it and transmitting it speedily. Research too anchors on good data. So as we talk about progress in Zambia towards universal health coverage, we have formed a very strong M&E framework, and it is promoting a data culture. And we have used tools that are available at the implementation level, at district level. And these tools, DHIS tools, are used to collect data, analyze, and transmit forward to higher levels. And this helps us to monitor our journey towards universal health coverage and our progress in meeting the legacy goals that we've set in our National Strategic Plan. The key challenges that we face in data and digital health services is inadequate and inequitably distributed ICT infrastructure, and this hampers speedy transmission of data. So we also see a proliferation of multiple M&E systems from various stakeholders with poor coordination. We also see inadequate investment in data systems. Therefore, the solution that Zambia has embarked on as part of the broad development agenda is to install towers in various parts of the country in pursuit of universal access to internet services. This benefits health services too, as our staff are able to easily transmit data. And we are also coordinating well with all the stakeholders and promoting the use of one M&E system. We are also encouraging our partners to leverage local solutions that are sustainable as we talk about processing of data. In a nutshell, I'm saying Zambia's transformational agenda anchors on strong M&E systems, and data is a top priority in our transformational agenda for universal health coverage. I submit.
Thank you, Minister. I'd like to turn now to Mr. Edwin Dikolati, who serves as Botswana's Minister of Health and Wellness. Minister Dikolati, Botswana created its own health data collaborative a few years back without any external support. Did you have the same infrastructure challenges that our previous minister just mentioned, the minister from Zambia? And can you tell us how you created your own HDC model?
Thank you very much, moderator, my colleagues. Moderator, in 2019, the Ministry of Health and Wellness conducted an assessment of the health information system and monitoring and evaluation, HIS/M&E in the country. The objectives being to review the multiple health management information systems and data quality processes with a view of recommending appropriate measures for strengthening the HIS or M&E. One of the main recommendations of the assessment was to adopt the Health Data Collaborative approach, which was then established and launched as the Botswana Health Data Collaborative, BHDC, in March 2020. The BHDC launch culminated after several consultative meetings and engagement with key health sector stakeholders. The aim was to bring all M&E and health information stakeholders towards a common HIS or M&E for purposes of efficiency, transparency, accountability, and ultimately leading to a better, improved health system. Implementation of effective monitoring and evaluation system is one of our national priorities. The BHDC aligns perfectly to our National Development Plan 11 and our Vision 2036 strategy. Thank you.
Thank you very much. I'd like to turn now to Bernard from WHO. Bernard, I'm sorry to say that we cut out a little bit at the end of your introductory statement. So feel free to go back and tell us what we missed. But I also want to ask about WHO's plans. And specifically, what are WHO's current priorities for supporting countries' data and digital efforts?
Catherine, thank you very much for allowing me to speak again very briefly. I certainly don't want to repeat the speech after we had gotten such excellent comments from the ministers. I think that is really at the core of what we are doing. The notion that we have to coordinate amongst the international partners to really support the country needs. Having one M&E system, having one data system, having one partnership that really is focused on the data that our ministers and our country colleagues need to bring better health to people. That's the only thing that drives us here. And I think that's also at the core of the new data division that's very excellently led by my colleague, Samir Asma, who you will see later, and of course, who is running the secretariat here. I think the other point I really want to make is that many people think that all the innovation comes here from places like Geneva or other capitals where they have big institutions. I think this is really a wrong perception. We have seen some of the very best innovation coming from the countries themselves. And I know, for example, that in Zambia, you have implemented a survey, one of the first countries in the world that has implemented a nationally representative survey using mobile phones, cutting down the time, increasing the precision, and delivering health data that can really be acted upon in a much shorter period of time, with much less errors than we had in other systems. So we really look to this innovation coming from the countries, coming from the partners, trying to bring those all together to really empower the triple billion approach, where we have the health of the people at the center at all levels of our organization. So we're looking forward to this collaborative and to this system and to this network and working very closely in all we do. Thank you very much.
Thank you, Bernard. Your point about innovation happening in countries is well taken. Turning now to Kenya. Kenya was one of the first countries to join the Health Data Cooperative and has been a leader in data and digital efforts ever since. Mercy Mwanganji is the Chief Administrative Secretary in Kenya's Ministry of Health. Mercy, have Kenya's data and digital priorities changed over time? And to Bernard's point about innovation, do you have innovations in your country about which you're particularly proud?
Kenya has made great strides in ensuring that we're able to make advancements when it comes to civil registration and vital statistics, interventions, as well as ensuring that we have an end-to-end digital health solution. So we've made tremendous gains. As a frontier country, we were able to put together the Health Data Collaborative. We were able to bring in partners across the divide from all the different sectors. We were even able to bring in line ministries who supported us in the initiative. For example, the Ministry of ICT, the Ministry of Vital Statistics, all together and support the initiative. We look back years, perhaps now 3-4 years since Kenya started the collaborative. We are hoping to focus on more priority areas, with the main area being that of civil registration and vital statistics. Kenya is in the process of launching what is known as the Huduma number, which is essentially a unique identifier to be able to identify patients, to identify the citizenry and have them in one database. And so we are looking to expand this to ensure that every Kenyan born now is able to have access to that Huduma number, and then is able to ensure that this Huduma number, is linked all to the various government services that are available. And so that is one of our key priority areas, strengthening our civil registration and vital statistics. Another second key area is when it comes to our digital health systems. We're working to roll out an end-to-end solution across all health facilities within the country. And this solution will again be linked to this unique identifier to be able to ensure that we're actually using our data when it comes to planning, when it comes to forecasting, when it comes to allocation of resources.
Thank you, Mercy. Alan Malechi, I'd like to turn to you next. You're the Executive Director of Kellen, an NGO that strengthens the capacity of East African organizations to protect and promote human rights in vulnerable populations. You're also a Global Fund board member representing civil society. Alan, what do we need to know about vulnerable communities, and how can data and digital efforts help them?
Thank you very much for the opportunity to contribute to this conversation. I think what is important to know about vulnerable communities is that they must be put at the center of the design to collect data, of processes to develop digital technologies, and their vulnerabilities taken into account so that they are safeguarded for any possible breach that are likely to happen. A data system that allows for communities who are vulnerable to give their input, to understand the process, to be able to contribute to it, and to hold both partners, governments, private sector accountable in the data is used, in how the data is collected, in how digital technology is used is extremely important. So a participatory process that allows for communities, civil society, and vulnerable groups to be part of the design, and rollout of the process is extremely critical. But generally, all data collection, all digital technologies that are used from a point of civil society and communities affected by various diseases must be grounded on human rights, must be grounded on legal and ethical frameworks that respect the right to health, that respect the right to non-discrimination, that respect the right to privacy, and does not put them in a state that makes them more vulnerable. And most importantly, data that is collected must be accessible to all in a manner that doesn't breach privacy, but is also used for purposes of playing the critical transparency and accountability around how health interventions are done, around how services are located to communities, and around how the most vulnerable are taken into account.
Thank you. Thank you, Alan. Bernardo, I'd like to turn back to you for a moment. I'm curious if you have any reflections on what we just heard from countries and some of the issues that Alan just raised.
Yeah, thank you very much. I mean, first of all, I would like to really congratulate the organizers of this event to bring such a diverse experience into discussion, because as we talk about the partnership, it's also very clear that we bring all of the partners together, not only the technical specialists, but also the political leaders, as we have here with two ministers speaking very skillfully, very clearly about this issue, but also civil society as a critical partner in building better data systems. And one of the things that we actually have been doing is looking into also the data principles, which means how can we make sure that across the world, across all different societies, across the mankind, in a sense, that we create the same principles that everybody can follow, including, for example, data privacy. That's incredibly important. Of course, if we have better data from people, from individuals, it allows us to target our interventions much better, but we have to do this in a way that data cannot be misused. The privacy of the individual, especially in areas of health, which is very personal, is incredibly important. So that's one of the focus areas of our work, where we believe that we have a responsibility to help everybody to come together. And I think we look to the Health Data Collaborative to help us in doing that job.
Thank you, Bernard. And I think the privacy issue is a very good one. I'd like to turn to Chitalu now. And Chitalu, if you've got experiences in that privacy realm, if Zambia has had some dealings with privacy, be interested to hear how you're handling that issue. I also want to know, what do HDC partners need to do differently to support your country and their digital and data efforts?
Oh, thank you very much indeed. And just on what I said earlier on, what partners need to do is to build a coalition with government and other stakeholders in the country to invest in a robust ICT infrastructure to support speedy transmission of data for information, for decision-making, and for planning and for resource targeting. Two, I also believe that we need to continue working with our partners to invest in software to support, yes, certain diseases such as HIV and other diseases such as TB, malaria. This disease-specific software, like in smart care, this is important, and we need to continue investing in such solutions. However, as we look at disease-specific software, we need to look at other fundamentals of a health system, such as human resource, healthcare financing, such as drugs, the supply chain, and invest equally in information management systems, data management systems for those fundamentals of health systems, so that we take a comprehensive look at health systems anchoring on good data. And thirdly, I'd also urge that we continue to invest in technology, such as use of mobile phones powered with apps to support specific programs and speedy transmission of data for quick decision making. And finally, it would be good to periodically and regularly sit with coalition partners to identify priority needs in data. And as we focus on the global agenda that WHO has set, that is universal health coverage, it is important that we pitch information management systems high and build that coalition for strong data management systems, so that we could use it as a basis to even monitor our development and as a basis to track our progress towards universal health coverage. And that's the basis that Zambia's transformation agenda under the stewardship of President Edgar Chagwa Lungu has embarked on. Thank you.
Thank you, Chitalu. I'd like to turn to Edwin now and ask, did anything that Chitalu just said have resonance for you as well? And how is the HDC model supporting and prioritizing your efforts in Botswana?
Thank you very much, moderator. A Botswana Health Data Collaborative roadmap has been developed, and it outlines the strategic approach towards strengthening the health system and monitoring and evaluation in Botswana. Implementation of the roadmap is done by stakeholders in the space of health information systems and monitoring and evaluation, coordinated by the ministry. Some of the HDC roadmap priorities are as follows: adoption of WHO core 100 M&E indicators, strengthening the civil registration and vital statistics to report complete information on births and deaths, adoption of the district health information system as the default reporting platform for the health sector, use of open standards for interfacing information systems across the country. I thank you.
I'd like to turn to Alan. And Alan, this is a subject I know that's near and dear to many of our hearts. What do governments and partners need to do differently to be more accountable to those communities left behind?
Thank you. I think there are three important things that governments, development partners, and even donors should do and can do in order to ensure that they're more accountable to communities and vulnerable populations. I think the first thing that needs to be done and has to continue to be done is a meaningful involvement of communities, and especially those who are affected by various diseases in design and implementation of the process. I think the second and most important issue to be done is to ensure that we have got strong data frameworks at the national and regional levels. Kenya has a Data Protection Act, for instance. The AU protects the right to privacy in terms of sharing data. So those are some of the examples where governments, countries need to invest in strong legal and ethical frameworks, because they are both needed to create the parameters and the environment of the collection of the data, of the use of data, and the accessibility of the data. And I think most importantly, as we have also seen in a number of countries, including Kenya, we need independent oversight bodies, such as we have a data commissioner in Kenya, who is independent of government and is able to give independent decisions and guidance around the use of data, breach of data, remedies to be given. And then lastly, we must also ensure that our judiciaries are empowered so that citizens and persons who would want to hold any element of data collection, use of digital technologies accountable, is able to do so. I just want to quickly say that there is a lot of promise for addressing inequities and barriers to healthcare and promoting quality access care if we use data and digital technologies in a way that would be beneficial to the most affected.
Thank you, Alan. I'd like to go back to Mercy. Mercy, there are many national and international partners in Kenya. What do HDC partners need to change or prioritize when supporting Kenya's data and digital efforts?
Yes, indeed. Kenya does have a multiple set of players when it comes to data. We have international partners. We also have local partners, the HDC initiative. One of the key things that all these partners need to prioritize is to ensure that government plans are at the center of it. We need to avoid duplicating efforts. We need to be able to instead leverage on the multiplier effect. And so one of the key priorities as a government that we have is to ensure that all partners who are working towards the really, worthy, meritable objectives of HDC are aligned towards government planning and are ensuring that there's an accountability framework and matrix that aligns. I think another key important, in terms of a request to HD partners is to ensure that we continue putting incentives to ensure that this data that we use, this data rate, is actually data is on demand for use. And so it becomes very important to ensure that as we continue moving forward as a country with all the partners at play, that we prioritize on the government agenda, we avoid duplication, but also we ensure that we are putting in place mechanisms that can actually incentivize data use. And these are some of the things that we are considering, particularly as we roll out the universal healthcare agenda, which we all appreciate requires an immense amount of data. And this data then requires to be used for evidence to be able to guide countries towards the UHC journey. And so it becomes very important, really, and I must emphasize, to avoid duplication, to collaborate, and to ensure that there is transparency and accountability in our initiatives. Thank you.
Thank you very much, Mercy, and a big thank you to all of our panelists for kicking off our event. We'd like to take you next via video to Kenya, as Mercy was mentioning, where we can see and hear from community health volunteers serving vulnerable communities in Nairobi.
When a community health volunteer goes to a household, they register the households. Is there an expectant mother? Is there an under 5? Is there people with diseases? So it is my responsibility to look at the data, interpret data, analyze what has been collected, and plan for any action depending on the data that was being collected.
My main responsibilities in my community is to visit my households and to make awareness, like to talk with the young mothers and the pregnant mothers on how to come to clinic and how they can bring their children to clinic.
We have 10 CHVs in every community health unit. So that means for the 28 community health units, that is 280 CHVs. 280 CHVs, each of them take care of 100 households.
Yeah, it is difficult. The workforce also, we are very few who are supposed to collect all that data, put it together, interpret, understand, put it in the DHIS, go give feedback to the community. At times most of the time it is a very big workload.
It's a lot of work. You cannot even know which was where most of the time. But it's true, it's a big bulkage of papers.
How I would wish if actually everything was electronic. That would have been so good because it would actually also help us sieve and figure out and give us the exact information or help us in analyzing the data that we have.
So it will be my prayer if the government to come down on the ground and see the need, because we are serving a lot of community and a lot of things are happening. So one person is not able to maneuver all this work.
The volunteers, wow. The volunteers play a very big role that cannot even be measured through the data that we put in writing. The volunteers have changed humanity. They've actually helped the people down there in the community.
I'll continue because that is my talent, because it is inside my blood or inside my body. I'll continue and continue until my end of my life.
One of my favorite quotes from that video is about the volunteers. They're changing the face of humanity. And that's what all of these efforts are about, really. Our next panel looks at how the right partnerships can assist in that goal and how partners can respond more effectively to the communities they serve. We're going to begin our next panel with Tor Godal, a special advisor to the Norwegian government currently, Gavi's first executive director. And Tor, you have worked within the WHO on tropical disease research, and I know you've also worked with the Bill and Melinda Gates Foundation. You are clearly a man who knows a lot about partnerships. What do members of partnerships such as the Health Data Collaborative or the SDG Global Action Plan need to do differently to maximize health impact for countries?
Well, I think we first now from the first panel very clearly heard that one has to have an attitude of humility, because we are all very excited about the recent developments in technologies, and we tend to bring them without thinking about what the demand from the country is, as well as we heard about the importance of local innovations and so on. So I think taking a humility approach to actually to listen to what the countries need and what can they build on in the country, so that one do not bring in something that is incompatible with their own system. I think that is very important. And then related to that, as we again heard, is that the different partners need to come together so that they do not duplicate, because if you can duplicate between yourselves, and after 50 years in global health, the most ineffective things I have seen is when two partners have different approaches to a system like digital health, and then they fight between each other about who has the best solution. That's a total waste of time. So I think for a collaborative, it is very, very important that one actually base it on collaboration and rather than on duplication. Thank you.
Thank you very much. And I'd like to turn now to Marika, and forgive my pronunciation of your last name if I don't get it right, but Windrox, who is currently the Chief of Staff and the Interim Director of the Global Fund, which is a partnership designed to accelerate the end of epidemics like AIDS, tuberculosis, and malaria. The Global Fund has invested more than $4 billion spread among 100 countries. So my question is, how is the Global Fund prioritizing the use of data? And how are you dealing with this idea of the duplication of efforts that we just heard about?
Thank you very much. And thank you very much for including the Global Fund in this session. And I really enjoyed to listen to the country examples and the country speakers. The Global Fund strategy prioritizes strengthening countries' data systems for health, as well as countries' capacities for data analysis and use as critical elements for better targeting of programs, improving program quality, and providing for more efficient service delivery. The Global Fund has a strong history supporting integrated national systems for program data reporting and use from community to national levels. Our aim is to support country data systems that are skilled, sustainable, reliable, and used for program improvement and impact in coordination with partners. The key reason the Global Fund is committed to be part of the Health Data Collaborative is that the collaborative has been an effective partnership platform for us to invest in country data systems more efficiently for greater impact. One specific example, I think one that also very much relates to the previous session and toward the point that Todd was making, is with regards to the country data systems for community health services, of which the Global Fund is one of the key investors. Through the Health Data Collaborative, specifically the Community Data Working Group, the Global Fund supported UNICEF to develop a global technical guidance on the indicators and systems for monitoring health services provided by community health workers. Working through the Health Data Collaborative enabled a highly collaborative and efficient process to develop this guidance and tools. It resulted in indicators and guidance that are standardized, harmonized, and endorsed across all the relevant technical partners and stakeholders, and that countries can adapt to their specific country context without having to start from scratch each time or adapt to each partner or funding. So it really responds to country needs and country demands. In this case, the Health Data Collaborative enabled the Global Fund to meet the Global Fund's specific needs, knowing that we were incorporating the technical expertise across many partners and that our support would produce outputs that other partners would be able to support as well. We look forward to continued operational collaborations through the Health Data Collaborative platform to strengthen our investments in the national data systems that inform the fight against the disease and contribute to better health. Thank you.
I'd like to turn now to Monique Vletter, who is the head of the Global Financing Facility Secretariat and a practice manager at the World Bank. The GFF provides catalytic funding and technical support for countries to develop and implement national plans for women, children, and adolescents. Why is funding programs for women, children, and adolescents so important? And what's different about these populations, and how can partnerships help these populations?
to be on this panel and see so many old friends as well. And this is really at the core of GFF, and we feel very, very passionate about the data issue. And it's really inspirational to hear the commitment of many of the countries in the previous panel. So GFF has a partnership approach and supports on the country leadership the prioritization of service delivery systems and long-term financing reforms to improve the health of women and children. And evidence and data is very much at the core of the approach. And I think there was no better time, a better example than COVID happened. The importance of the immediate use of national data systems to not look at the impact of COVID and the immediate pandemic, but to particularly look at the impact on the service delivery and essential services for women and children. And we could very quickly it's supported in collaboration with ministries of health in countries through the use and the analysis of national data through the HMIS system, see very severe disruptions in the ability of women and children to access services, both on the supply side as well as large increases in financial barriers to access services. And I'm using that example because having that data so early on in a crisis like that really and discuss what are the programmatic implications and what are the policy priorities to ensure that not just the COVID response is properly financed, but we also focus on ensuring that the service delivery bottlenecks for women and children are addressed this pandemic. And so from the GFF perspective, there's sort of 4 areas that we want to highlight and why data and investments in data systems are so important. And the first one is around, it gives us the ability to really focus and target those geographical areas and population groups that are most in need. And so in all of the 36 GFF country partner countries, we use data extensively to target really limited and scarce resources and make sure that we finance programs for those that are in need first. Then secondly, I also would like to say something about the financial data, because as partners, it's really important that we come together and we align around the priorities that we are finding in this data analysis. And we spend quite a lot of time with countries supporting resource mapping and expenditure tracking to make sure that after to financing certain priorities, that financing actually flows and has the intended impact. And then thirdly, I think I hear this from many of the speakers this morning, the investment in systems is really key. And a good example of that is the investment in civil registration and vital statistics systems that is taking place in a large part of the GFF countries, but that also broadens to national health, to national. And then finally, I think, and this is really the frontier also of partnership and the next phase of a collaboration between many of the partners that are interested in investing in this, is the issue of the use of data for implementation. And so it's really not an exercise to be able to report back or to donors. This is really about the hands-on implementation and ensuring that we in a regular way have high data to see, are we on track with our investments? Are the programs moving in the intended way? Is service coverage and quality improving, etc.? And so that we then have a system in country in which we collectively analyze the data, look at it, and use it to influence how we support better implementation and better results. Because in the end, whether it's about partnership or investments in systems, etc., what we are collectively interested in is showing the impact and the results. And so we're really excited to support HDC, and there's not one agency that can support this agenda alone. There's a big data agenda going forward. We see the frontier of that around the essential services and the innovations that we need in service delivery that will require very good measurement systems, as well as the health system measurements that we need to collectively refine, that we're making the right investments and that we are on track. Thank you so much for the opportunity.
Thank you very much. I'd like to turn now to Kevin Kane. Kevin is the Principal Deputy Director at the Center for Global Health, which is a division of the U.S. Centers for Disease Control and Prevention. You support long-term health information systems, surveillance, and of course, acute responses to outbreaks and pandemics. Speaking of which, COVID-19 has shown a new light on data and digital efforts, especially as we all monitor outbreaks in our communities and around the world. What can the pandemic teach us about building sustainable health information systems?
Great. Thank you, Catherine. And I do hope you can hear me now. It is great to join you today for this important discussion. The premise of your question on long-term importance is critical. Even as we respond to acute issues like that of COVID-19, data is indeed a public good, but it's only a public good if it's actually usable and used for the good of the public. Ultimately, a country needs to have data that will identify gaps, which if addressed will benefit the population. These data should guide the actions of all partners so that everyone can have a common understanding of needs and that countries and partners can work together to address key gaps. Managing COVID-19 requires collection and use of appropriate data, but countries can proactively use resources for COVID-19 to address COVID-19 needs in a way that strengthens their overall system. For decades, the US CDC has supported countries in establishing health information systems, surveillance systems, and outbreak response systems. Since then, in close partnership with the global health community, we've focused on helping countries to improve these systems through automated data collection and reporting, better interoperability across systems, and more seamless linking, sharing, and visualization of data. And we've been there in the last year alongside our partner governments as they adapt these existing systems to address the COVID response. For example, there's the Integrated Disease Surveillance and Response Framework, or IDSR, that makes surveillance and laboratory data reporting more usable, helping public health managers and decision makers to improve detection and response to the leading causes of illness, death, and disability in African countries. During COVID-19, this framework was supplemented to include the capacity to capture and report case-level data for COVID-19 through DHIS2 and the COVID-19 Digital Data Package. This enabled countries to accelerate case detection, situation reporting, active surveillance, and response to COVID-19. Secondly, as part of the Global Polio Eradication Initiative, we've supported countries to use their polio surveillance and response networks to conduct COVID-19 case detection, contact tracing, laboratory testing, and data management. I think these experiences remind us that our health systems are always capable of more than they already achieve, and that the Sustainable Development Goals and global health security are within our reach. But achieving these goals requires us to be proactive. Stronger systems will most definitely not come automatically, but they will come if we partner together with the end goal in mind to help countries have systems and data that can help them focus public health actions on what's needed the most, and that is achieving the greatest good for the people. Thank you again for having me here today.
Thank you, Kevin. And, we hear the word collaboration coming up again and again. I'd like to turn now to Rachel Snow, UNFPA's Chief of Population and Development. UNFPA, for those who don't know, is the UN agency that supports sexual and reproductive health in over 150 countries. So their work includes data collection and, of course, analysis. So, Rachel, how can a multilateral agency like UNFPA use partnership approaches like the HDC or the Global Action Plan to foster greater collaboration?
Thank you very much, and it's a pleasure to be here today. You can hear me just fine? Yeah, okay, thanks very much. I'd like to make 3 points. In the first, I just want to underscore that the Health Data Collaborative in our view, absolutely has it right. The focus needs very much to be on strengthening local institutions and national systems. So very much lauded there. But the second point is an encouragement to give much greater attention to going geospatial in the data. UNFPA, because of our longstanding work on census over many decades, has been increasingly embracing the georeferencing of population, institutional, and development data. And what we find, of course, is that this is crucial to what my colleague has just mentioned from the bank, which is first locating where needs are greatest. So we talk a great deal about who's left behind, and that's evident in tabular data to only some extent. But what georeferencing offers governments is the potential to look much more closely at where the problems are most profound. If that's combined with population data, we go from not just here's where the districts are worst in terms of incidence or prevalence rates, but suddenly we can also see where are the districts where the largest number of people, women and girls, often in our interest, but people in general are in need. And quite often as we map those differentials, what you see is that when you add the population data in geospatially, you end up with a different set of districts that may be your priority districts in terms of reaching those largest number of people in need. The other, really important dimension of going geospatial is we find that, of course, the visualization of these data make it so much easier to advocate and convey needs to non-specialists. That the easy visualization is an enormously important communication tool. And as we, again, are georeferencing census, we find interest from people who may never have been interested in such underlying data before. The last comment I want to make is an encouragement that we focus much more on the next generation and the extent to which we are building institutions in the global south where we're working for a next generation of digital scientists. I would include women digital scientists, of course, with a special interest, but I think we need to be really having that long end game in mind and paying much closer attention to the extraordinary burden that many schools of public health, digital schools of digital units are under, the extraordinary student demand, small numbers of professors, small, excessive classrooms, and the universities are the future in this area. And I just think that this would be an area where we could anticipate much longer and more sustainable success in this digitization of health data going forward. I'm going to stop there with thanks for the opportunity to be with you today.
Well, thank you, Rachel. And as a communicator, I couldn't agree more on the value of data visualization. So thank you, and thank you to all of our panelists. Next, in a short video, we'll be hearing from thought leaders on the power of data as a global good, what unvaccinated children can tell us about larger health trends, what's been revealed about data gaps, looking at data as a combination of experiences, and what makes for a good partnership. We'll begin, though, with what the COVID-19 pandemic has taught us about data.
The COVID-19 crisis has made clear that good health data can save lives. The pandemic underscored the vital importance of reliable and up-to-date information in the right place, at the right time, and to the right people. Comprehensive health data is a global public good. It allows us to learn from each other and focus on effective solutions. Partnerships such as the Health Data Collaborative are crucial. Partnerships like this help countries provide quality foundational data in a better way, which then again improves healthcare quality and health system performance. In the end, we can achieve more when we work together.
So Gavi is very focused in the next 5 years on reaching zero-dose children. Zero-dose children are those children who do not receive even a single dose of the most basic vaccine. And for us, those zero-dose children are markers of those communities that suffer from a lot of other deprivations. So mothers do not receive skilled birth attendance, antenatal care, contraception. These communities do not have often access to water, basic sanitation, nutrition, and therefore really bringing zero-dose children front and center of all Gavi efforts in the next 5 years, we are hoping would help us reach these communities, not only with immunization, but a range of other essential services. And as we pursue this quest to reach zero-dose children, data is going to play a very important role, because we need to first understand where the zero-dose children live and why they are zero-dose.
This year, particularly with the COVID pandemic that's affected every corner of the world, has really brought home to us how essential good data is as a tool for governments and for individuals to respond to a health crisis. And I think it's really illustrated how much we need data which is not just accurate, but also fast. If governments are going to respond to the pandemic and make policy in time that responds to the world as it is today, then they really need to have data which also can be absolutely up to date. This year's also, it's shown us how important data is. It's also revealed, I think, horribly, some of the huge inequalities and gaps that exist in data. So, for example, a vast majority of the world's population doesn't have their deaths registered. You know, we've all been sort of poring over the numbers of deaths and looking at and what the figures look like every day through the COVID pandemic. But most of the deaths that occur in the world are not registered. And that's just one example of where the huge gaps that we have in data are really going to limit the effectiveness of government in trying to tackle this and every other health challenge that they face.
If I'm responsible for managing a local or national response to COVID-19, I need information about who's affected by the disease, where they are, why they've been affected, and what needs to be done to help them out. The answers to these simple sounding questions of who, where, why, and what requires really good information, but to have that information, we need data. Data is numbers, data is experiences, data is anxieties and concerns. And we usually use the word data in the plural because it's a combination of multiple experiences, multiple quantifications. Without these data, our information will not be good enough to make the decisions that are so important for enabling populations to come through this pandemic in the best possible way.
The recipe for a good partnership is really that every constituency understands their part and is willing to come and punch over their way to being a part of an alliance that actually then facilitates and enables them to do more together than alone. And so each constituency has a distinct part to play. The private sector, governments have a distinct, youth-led organizations are critical. So all the constituencies have their unique, ingredients in this recipe. And so you put it together. Partnership is all about you putting all of these ingredients together and getting something that's more of a global good and a change that is necessary.
Most of us here today have accepted an audacious challenge, which is achieving the health-related goals laid out in the SDGs in the next 10 years. The COVID-19 pandemic has not made that any easier. So what are the right ingredients necessary for data success during the decade of action? Our next panel will talk governance, open data, partnership, gender awareness, and disaggregated data, among other topics. Welcome to our panelists. I'd like to start with Francesca Ferrucci. Francesca, the UN Secretary General is developing a new data strategy with data governance at its heart. As the Assistant Director of the UN Statistics Division, you are at the center of this. And this will certainly be a big topic at the UN World Data Forum you'll be co-hosting in Bern next year. What elements of data governance do you consider most important?
Hi, and thank you for having me today. Well, the data demands of COVID-19 have accelerated in many countries a process of transformation with a larger use of innovative data tools and data sources. In a recent survey to national statistical offices, 82% of countries were involved in collecting data on COVID-19, and the majority of those countries reported having established new partnerships to implement new methods and use new data sources to address the new data needs. But those countries also reported that the main challenge in establishing these new partnerships were the lack of a collaborative framework and the lack of clear agreements for data sharing. So there is a need for a new approach on how data is managed and delivered. A joined-up approach where various parts of the government and all data actors work together under a common framework to ensure that data is governed, is managed and reused in a secure and in an efficient way. The implementation of a data strategy should cover the implementation of data protection and data sharing frameworks to be able to make sure the most extensive use of administrative data sources and all other sources for statistical purposes. And the framework to ensure data quality, guaranteeing quality and confidentiality are key foundations of official statistics. And it should include open data tools and principles supported by a legal framework to ensure the right of information while maintaining confidentiality. The national strategy should provide a general framework for the national data ecosystem, where the NSO, the National Statistical Office, plays a central role, building on strong foundational data programs such as CRBS, population census, etc. And most importantly, with the appropriate resources, and where all the actors involved benefit using and integrating new data sources with standardized methods, with the same rules, with the same mechanism, and with strong collaboration mechanisms. Data is a public good, and the data ecosystem must be governed and managed in a way that it benefits all citizens and all users. Ensure that we count everybody, leaving no one behind, as called for by the Agenda 2030. Thank you.
Thank you so much. I'd like to turn now to the co-founder and managing director of Open Data Watch, Sheda Badi. Open Data Watch is an international organization that encourages government offices, especially in low and middle income countries, to improve the coverage, the quality, and the openness of official statistics. Sheda, how can countries and HDC partners address the inherent tension between making data more publicly available and transparent on the one hand, yet respect individual privacy rights on the other hand?
Thank you, Catherine. First, it's important to recognize the value of open data and that it brings a lot of efficiencies to countries for critical decision making. We've seen it during the COVID-19, for example, for data and open data protecting and saving lives. But there are also many other indirect values of open data, increasing transparency, accountability, and important trust in data providing agencies. In fact, my group, as you noted, monitors this, and in our latest round, we see that countries are actually improving, and it's really good to see that open data is being taken seriously. My second point is that what's being advocated on open data by the UN, as Francesca mentioned, and leading data organizations like the WHO, is what we call responsible data sharing practices, which is guided by principles such as WHO's data principles and the fundamental principle of official statistics. But aside from these principles, there are many good technical methods that exist and are being refined. We have on the less expensive end of scale for data privacy, they are removing personal identification, limited aggregation, and recording of data, recoding of data, which is very important. And then there are much more sophisticated methods of privacy algorithms and whatnot. So the point is that this is a fast-moving field in the demand and the supply side, of course. So it's not to say that everything is okay and we have lots of work to do. But what's important is that there is a lot of good practices and good principles that we could build on and adopt and move now. And I think the Health Data Collaborative could really be instrumental in bringing these good practices together and being adopted. But my final point, if I may, is that all countries and agencies that produce and disseminate data should really note that it will take investment in preparing the data for dissemination so that we can get the benefit of open data, but the confidentiality of individuals are safeguarded. So the final word is that if data are truly to be treated as a public good, then there should be public funding to make data widely and securely available. Thank you.
Thank you so much, Shada. Turning to Dr. Rupa Datt. Dr. Datt is a practicing physician and the executive director of Women in Global Health, which aims for gender equality in all areas of global health. For example, women comprise more than 70% of the global health workforce, yet only 25% of women hold leadership positions. And when it comes to data, estimating burdens of disease by gender, which might appear to be a relatively simple task, is still a very, very difficult task. Dr. Datt, to ensure gender disaggregated data is not only collected, but used for health impact, what do HDC partners need to change, and what digital efforts can support this?
Great. Well, thank you for this opportunity to be here with all of you and be part of this very important conversation, a very tangible conversation. And before calling our call to action, really, when we call for sex and gender disaggregated data, it is often dismissed as a marginal women's issue. But one of the things that COVID has really made clear is that except looking at the oldest age groups, more men are dying than women, and we need to know why. It is also clear that from the partial evidence we have that more men and women from certain ethnic and racial groups are dying in some countries, and more frontline health workers. Without sex disaggregated data that takes an intersectional lens, policymakers are working blind. We don't know which policy measures to put in place to protect the most vulnerable. We don't know who are the most vulnerable, and that's everybody's issue. And that's why really this call for the right ingredients, when we talk about sex and gender disaggregated data, we must go beyond that and also truly have an intersectional lens. So our call to action really is for all of the HDC partners, but especially governments, to really join in and link up with all the different partners, and including engaging civil society organizations, research institutions, is one, stop operating blind. We need to disaggregate data by gender, sex, age, other social determinants of health, disability, caste, religion, race, profession. And reality is, it is possible. I have seen myself as a firsthand health provider, what it looks like when I'm working in a hospital where everything is disaggregated in COVID-19 by all those stratifiers, and another hospital where it isn't. We really need to know the patients and the services that we're providing, and we know that our public health officials need to know that even more. And right now at the country level, as we've heard from our country colleagues, we're operating blind without this data. Second, it also matters what type of data we have. We need both quantitative data, but also qualitative. Qualitative is especially important for those populations that are minority groups, are marginalized, those leave no one behind, as we've heard. And we need to really make sure that we have that qualitative as part of building the research system that we're looking at. Real-time data, implementation data. Too often we aren't really looking at how solutions, when we put forward global health solutions, how that really impacts the results in real time. So really looking for that type of data too. And then really echoing a lot of what's already been said today, really making sure that data is a global good and ensure that data gets back into the hands of all communities, especially girls and women and the hardest to reach, not only to keep them informed, but also to keep them equipped so that they can engage in shaping the health agenda, become decision makers and leaders in their communities that are informed by evidence. And we know too often data does not have to go back to the communities that it has been collected from. And four, really work in partnership from the start. We know that governments need to work not only with research institutions, but also with the communities that they're trying to reach. So that's where civil society organizations are really critical partners. And particularly also looking at the private sector too, that is collecting a lot of this data in different ways and formats and often in innovative ways. So really being comfortable engaging the private sector in this data process. And finally, really the call to action comes back to governments. Governments deliver on your commitment. What we're asking is nothing new. These are commitments that have been made in the Sustainable Development Goals. So please work with all of us so that we stop operating blind, and that's really the right ingredient.
Thank you so much, Dr. Dodd. And you mentioned the private sector, and we hope to be able to speak to someone from the private sector in our later panel. One data point that I have about you is that today is your birthday, so happy birthday from all of us, and thank you for spending part of the day with us. Turning now to UNICEF. Yes, round of applause. UNICEF has been at the forefront of collecting, storing, analyzing, and using disaggregated data that Dr. Dodd just talked about to address inequities and to leave no one behind, which is, as we all know, a main tenet of the SDGs. Mark Hereward is UNICEF's Associate Director for Data Analysis, Planning, and Monitoring. Mark, can you share some best practices and tools that could be used by other HDC partners that you've come across?
Thanks, I'd love to, and it's such an inspiring meeting today. I'm really excited to be with so many people who share the same concerns and the same excitement about the use of data and how we can make a difference through data, and really happy for UNICEF's role in this collaborative to be able to help bring together all these different ideas and tools and pushing the envelope to make a difference. So indeed, equity is in our lifeblood in UNICEF, and this shows in a variety of ways and a variety of tools and analyses that are available for everybody to use, and that indeed we often develop in partnership. Whether we start with the multiple indicator cluster survey, I have to mention that I'm the grandfather of that survey, so I was the one who started it in 1995. But really passionate about how it can be used not only for many kinds of disaggregations, which are really important for identifying groups that may be left behind and inequities, but also that we can use that methodology to do surveys of particular subgroups. So, for example, in some East European countries, we have separate mixed surveys on Roma population, and so we can go in depth into particular population groups to see where the inequities may lie. But also, data may be collected, but then are used if they're not analyzed. And as an example of nutrition analysis in recent the last 2 years, we've gone back over 500 nationally representative surveys, not only mixed, but other kinds of surveys, for disaggregation of nutrition data on key indicators. We make it available publicly. We make the Stata codes and everything available publicly. China, of course, open data all the way, and so that's that's the way that we an example of the kinds of dissemination that we aim to do. And of course, data visualizations to if as particularly geographic analysis, to be able to look and see where particular population groups may be left behind, or maybe in particular need, or maybe facing particular challenges. Back to collection, the other way that we're working and innovating is around the so-called last mile data collection. So working in communities to digitize data collection, not only to save that poor health worker that we heard at the beginning in Tanzania from 65 hours of duplicate paperwork, but to make data immediately available for a feedback loop within the village to hold accountability, for a feedback loop within the district, going to the district level, and feedback loops higher and higher. So those are really important accountability mechanisms to be able to help identify inequities and make sure that they get addressed as well. And then other areas, you know, the cutting edge areas, small area estimation work and new technologies to capture information on populations like migrants, refugees, and the qualitative data. I think Dr. Dutt was referring to the importance of opinion, the importance of knowing whether services are actually giving the quality that they need. So simple but fast mechanisms to be able to collect those sort of data. And working always for more and more rapid data collection with the multiple indicator cluster surveys. Again, we have, particularly inspired by the events this year, sped up the innovation to have phone-based surveys using the mixed sampling frame, so we have nationally representative data, but to be able to get rapid, monthly data collection to track rapid changes. So lots of tools either available or underway, and looking forward to keep working with you all to make them as useful and as used as possible to make a difference in the lives of children. Thanks so much.
Thank you so much, Mark. And we are looking forward to hearing about some of those new technologies. Speaking of which, if for those in the audience who noticed a few empty boxes in this particular panel, we apologize. Technical difficulties separated us from a few of our panelists. But before we turn to our final panel, we'd like to once again go back to the field where the action is, this time in Botswana, and share a short video about a critical stop on the data journey. Data collected at the district level.
Data is very powerful and is very important into our district or into the national level.
We are able to understand and know how many of our clients need assistance. We're able to understand the burden in the district.
If we didn't have this data, we wouldn't know what we are doing. We wouldn't know who we are serving. We wouldn't be able to plan.
It influences the partnerships, how they would help the district, how can they help at national level.
So in this here office, that's basically where most of our reports come in from various health facilities on a monthly basis. As the reports come in, we track which report has been brought. We check if the information within the report is correct, if the information within the report is completed.
This data comes as raw. When it is compiled now, it becomes a district report.
Once that is done, the ministry at the headquarters, the coordinators of those various programs are able to track and see the pattern or the numbers that we capture within the DHIS.
Part of what we do is, with this data, we do our reports. So that informs us of where we are, what we are doing. Are we meeting our targets? Are we still doing what we said we were going to be doing?
We collect this data every day, every week, and every month. We analyze the data, and then we ensure to know which kind of clients do we have. This really helps us to make a case for provision of services, especially some of our clients are out in catchment areas, we are able to understand where to take our services to.
Without the facilities collecting that data and reporting to us, we'll never have an idea of what is happening in the field. Then we are able to react based on the data reported. Hence, I'm saying well, data is very important as far as decision making is concerned.
It helps in that when I refer a client to the next service provider, I already give that service provider information. So the client doesn't have to go there and repeat what they have said to me, and it saves them their dignity, and it gives them, you know, kind of some power to say at least, and also to reassure them that we are interested not just in their story, but we are interested in giving them service that will help them go through what they are going through.
It's so helpful, I think, to see volunteers on the ground. While we speak sometimes in abstract principles, it's always helpful to see what the reality is on the ground. Our final panel of the day gathers HDC stakeholders, representative countries, donors, NGOs, multilaterals, private sector, and academia to ask one central question: how do we make collaboration work? So let me turn next to Neil Jackson. Neil, you're the chief statistician in the UK's Foreign Commonwealth and Development Office. Your organization is a strong supporter of health information systems in low and middle income countries, and of course of the Health Data Collaborative. What do bilateral donors need and philanthropic foundations need to do differently in low and middle income countries?
So thank you very much. It's a pleasure to be here. I hope you can hear me okay. Health information systems we see as one of the key building blocks for a strong health system. High and timely health data provide the foundation to support the prioritization, planning, and delivery of health services and to monitor progress. So in the UK, we have a long track record in strengthening the availability, timeliness, and quality of health information in low and middle income countries through our investments in health systems strengthening. And also a strong focus on health, on supporting national statistical systems and working in partnership with others. I guess in terms of our priorities, we'd sort of single out three things. So first, investments in health information systems should be priorities. The alignment of financial and technical resources around a country-led strategy for health information can act as the basis to improve efficiency and accelerate progress. We think it's important to support capacity at the country level. It's important for producing, sharing, and using country, and really to help countries to leverage the available data and allow them to prioritize their own resources efficiently. And thirdly, we sort of see open data as being really important. The lack of public data sharing can inhibit accountability. Nationally owned country health observatories have an important part to play here, and that's an attractive feed data collaborative activities. It's also important to have safeguards in place to ensure the protection of individual data, and responsible data sharing practices can help with this. In terms of what donors need to do, we think a renewed focus on partnership principles are needed, and this should be about getting behind the country-led health information strategies and ensuring we're supporting and engaging in the national coordination mechanisms. Alongside this, we and others need to fully support the rationalization and integration of health systems in countries. I think part of this involves adjusting our own expectations for what data should be available and aligning our own data requirements with national data priorities. So finally, I think all stakeholders need to work together, make sure the impact of our technical and financial inputs is greater than some of its parts, and we Data Collaborative is having a really important part to play in making that happen. Thank you very much.
Thank you, Neil. Turning now to Heidi Reynolds. Heidi, your organization, Gavi, is at the forefront of using data and digital technology to assess performance and monitor equitable delivery of vaccines. You currently lead the country's performance team and have extensive experience in monitoring. What has Gavi learned about monitoring to ensure equity in the delivery of products and services?
Thank you. It's a pleasure to be here today. I just want to say that with our alliance partners, Gavi's focuses on reaching zero-dose and under-immunized children. Despite the gains in immunization coverage last 2 decades, there are still 10.6 billion children that receive no routine vaccines each year in Gavi-supported countries. And these are not often visible through existing data systems. They and their families are disproportionately clustered in communities which are typically among the poorest, with less access to health and other government services and worse health outcomes. Using data, digital technologies, and applying innovative approaches are critical to sustainably reaching these children. Coming together and engaging with a broad set of partners, especially civil society organizations, and coordinating our efforts to reaching those communities and families, they will benefit. And we as a Global Health Committee will make better use of resources and progress toward achieving our equity goals. It is a fundamental principle at Gavi to ensure that our data and digital investments respond to country-defined needs and plans. Triangulation of data from across sectors, including nutrition and education, strengthening subnational data, and the use of geospatial data and mapping are central to achieving our mission. For example, in Afghanistan, a dedicated data group composed of representatives from the EPI program, UNICEF, WHO, and partners from the humanitarian and private sectors triangulated data sources to produce a heat map, revealing the largest gaps and covered at the district level. Information about barriers to services is combined then with to drive programmatic decisions and improve immunization coverage. The COVID pandemic has shown great light on the need to scale innovations and to get quality and timely data, particularly demand-side data. Understanding vaccine mistrust and hesitancy is more important than ever. Innovations such as social listening, a technique to monitor social media channels, can help detect changes and issues related to vaccine mistrust. It's a pleasure to have been with you here today. I've been a supporter of the Health Data Collaborative since its inception, and fully support its goal to align partners and technical and financial resources with those data priorities and strategies defined by the committee. Thanks.
Thank you, Heidi. Turning now to Peter Hansen. Peter Hansen, you're with the Global Financing Facility, but previously you've worked with digital and monitoring efforts in Gavi and the Global Fund. What do partners need to do differently to align data and digital investments with country plans?
Thank you so much for the question, and good morning, good afternoon, good evening, everybody. I think that supporting countries to strengthen data systems and capacities is very fundamental to health and development and a critical enabler of achieving SDGs. I think it is absolutely critical that partners collaborate closely together in an intentional manner to do that in a way that is aligned around its own health goals and is aligned with the processes to achieve those goals. I'd like to highlight quickly 3 key points. The first is that I think that structured collaboration mechanisms such as the HDC are really, really important for enabling that collaboration in support of country data system strengthening. I think that the mandate and strategic focus of multiple partners and agencies within the data space is a great strength, and sometimes also is a complication for countries. And I think is really on honors, that is the hour of development partners to get our act together to make sure we are coordinated, harmonized in our approaches to supporting country data systems and aligned around them and their own efforts to improve those systems. And having a mechanism that provides just enough structure while still having flexibility and able to adapt to country circumstances and contexts, I think is really critical for enabling that. The second point I'd like to highlight is I think that complementary resources such as the digital investment principles are also really important. These principles do provide guidance to agencies to inform how we can support countries to introduce solutions toward their health systems and data system strengthening goals in a way that supports integration, institutionalization, scale, and sustainability. The third point I'd like to highlight is data use. I think there's no pathway to realizing the value of investments in country data systems and capacities without investing in a very systematic and intentional way in the effort to support the use data to inform decisions, the improvement of programs, quality, and outcomes at multiple levels. I think that the investments that countries themselves and many development partners have made in data sources and technologies obviously are very important. And I think it's critical that these investments in the data sources and the technologies are accompanied by investments and intentional efforts to strengthen the use at multiple levels, starting with the point at which the data are generated in the first place. I think there are real opportunities to make sure that digital technologies do not undermine the use of data at the point of data generation and many other levels, but rather reinforce it and support it. At the GFF, we're very pleased to be working with partners through the HDC, very pleased to have endorsed the digital investment principles and to work through these principles to our countries to strengthen their data sources, the use of technology and innovation and data use at multiple levels, ultimately to improve health programs as they progress in their journey toward the SDGs. Thank you.
Peter, thank you for that. Turning now to Tavi Arcola. Tavi, your organization, UNAIDS, has deep experience with assessing and monitoring vulnerable populations. And as a UNAIDS special advisor, you're passionate, I know, about service delivery and bringing innovation and technology to the forefront to maximize impact. So I'd like to hear two things, actually. How innovation and technology might assist us when it comes to monitoring vulnerable populations, and how can multilateral organizations such as UNAIDS best support country data and digital needs?
Thanks very much. One of the things that we've discovered in our journey on data use has really been to engage the civil society leadership and civil society partners to the data use. And we've really looked into how do we, bring in civil society to address issues around accessing services, and that in the past, by engaging them to the national level reporting and decision making in using that relates to laws and policies and how they're preventing people in accessing services, and two, now through community-led monitoring initiatives that are coming up across the partners, and it's been really central for also the way the Health Data Collaborative has been speaking around this to this topic and promoting community-led monitoring initiatives across countries. So we've really been pleased to see this civil society engagement coming into play. Another very key and central aspect of the Health Data Collaborative has been also to bring in the rules of engagement into how do you make use of this data? How do you secure the rights and safety of the communities that are providing that information? And I think those leveraging protocols and adopting similar types of rules of engagement in the data use, data security, data privacy have been essential. You were mentioning the innovative approaches gone into the data visualization direction, the promoting use of different tools that bring together, whether it's about DHIS or the community level data. We've tried to bring these data together and make them speak to each other so that you're really triangulating real time with the monthly data, looking at how services have been provided in the facilities, and then how the clientele, the community, the people who are using those services have experienced them. And they may discover issues around stigma and discrimination, rights violations, issues that are really becoming bottlenecks for certain populations accessing those services. And so those are key aspects that we've been working around, and we've been also promoting partnership, health data collaborative.
Thank you, Tavi. You mentioned rules of engagement, and that is particularly apt when we talk about the private sector. Ruchika Singhal is the Vice President of Global Health at Medtronic Labs, a company specializing in medical technologies, services, and solutions. And I should mention that the private sector is the newest constituency in the HDC. So my question is, what is the added value of the private sector? And what do private sector members need to do differently to support partnerships like the HDC?
Thank you, and it's an honor to be here today. Well, as the newest member of the HDC Collaborative, I would say from a private sector perspective, the design and innovation piece is the strength that we bring to the table. It's designing technology systems or software systems that are integrated with healthcare delivery models, or thinking through, the best types of data visualization tools, really understanding customer needs and designing those end-to-end models, looking at interoperability between systems, like in actual implementation. I think private sector can play a critical role there. We've been doing work in parts of Africa, Kenya and Ghana, and really, I think all the points that all of the various panelists this morning have mentioned, whether that's the patient advocacy groups or looking at the community health volunteer that's trying to decide of the 100 households that they need to support today, or that they're supposed to support, which ones to prioritize, or it's the Ministry of Health sitting and looking at that data to say, how do I allocate resources and where are the problem areas? Really understanding the needs across that entire spectrum and designing systems that are easy to use is not trivial. And see this entire space, the digital health space, there's a ton of innovation. It's continuously evolving, and it requires a lot of technical capabilities, resources, quite frankly, for maintaining that and doing all of that. I think private sector can play a valuable role there with the competencies that we can bring to the table. In terms of, I think your second question was around what can we do differently, how we can partner. I think we talk about collaboration. I feel like there's generally been hesitation on the part of the private sector to engage with the public sector more formally. And I think as we're starting to overcome those barriers, to me, collaboration starts with sitting around the table and talking to people. And I think the HDC is a great format and venue for that, for all of us. And then on a very practical level, I think making partnerships work on the ground requires everyone to build that trust and sit around the table and solve problems together and understand the needs and perspectives of each of the stakeholders. And whether that's a district hospital where there's multiple stakeholders in a community, we all have to sit around the table together, understand how to use these technologies, how do we meet everyone's needs and imperatives, which I think are at a macro level very similar. But so I feel that how we sit and operationalize a partnership is important in very practical ways. So thank you.
Thank you, Ruchika. Collaboration, sitting around the table together, as you said, is key. And I think it's safe to say that many HDC constituencies are eager to see the innovations the private sector can offer. Another constituency of HDC is the research, academia, and technical networks, represented today by Deborah Jackson. Deborah, you've worked at UNICEF previously. You're currently in the London School of Hygiene and Tropical Medicine. And we know that these networks research, academia, and technical networks play a vital role in providing technical support and in strengthening standards for evidence. What are additional added values that the research, academia, and technical networks bring? And how can HDC working groups support country data and digital efforts for health impact?
Okay, great. Thank you. All right, so member working groups are the heart of the HDC. I participated in 4 different working groups and the steering committee since HDC was founded. Another colleague mentioned she's been there from the beginning. I think so have I. What's interesting is that 2 of the ones I participated were pre-existing before the Health Data Collaborative. And this is a real point. HDC didn't create new groups if a global collaborative already existed. Instead, they partnered with those global working groups to improve coordination and avoid duplication, which is our core mission. So, for example, Monique from the Global Financing Facility mentioned CRVS in an earlier session. The CRVS Global Working Group has global stakeholders working in civil registration and vital statistics with a formal secretariat at UN Stats. Partnering with this global working group has been critical to shift the agenda on counting those who have not been counted through health sector and CRVS partnerships. So working with groups that already existed. On the other hand, working groups have also been developed new to address specific issues also in the HDC. 2 of those have been the Routine Health Information Systems and the Community Health Information Systems working groups, which were developed as part of HDC. These brought together a wide range of stakeholders who worked to develop a single package of standards for HMIS indicators, which are now on the HDC website. What was great is that each group of stakeholders from each, disease or systems area contributed their own indicators and sort of global indicators. And so, you have reproductive, maternal, newborn, child, adolescent health, malaria, immunization. So basically, you brought all of these different groups together to do a single, recommended package. So once again, collaboration and coordination. Also, a critical benefit of the HDC is the diversity of membership. So, with different constituencies. I'm speaking today, as Catherine mentioned, on behalf of the research, academia and technical constituency, also known as RATNet, which plays a key role in capacity building and ensuring standards of evidence and research are robust. Our focus on 3 S's, which directly link to supporting and the outputs from the working groups. First, we seek to help HDC build a catalog of research, academia, and technical networks working on health data. Then we ask those those members to show public goods and work that they're doing in countries that they are willing to share with our constituencies of the HDC and with the working groups. And so that comes to the last S, which is spread, where the working group partnerships come in. We help disseminate HDC and RATNet member updates and their respective networks. So a really big network is AHIN, which is in Asia. Many of you may have heard of it. And we were able to partner with the Alliance for Health Systems Policy and Research, another research network, and in call for proposals and sharing of HDC meetings. And so really it's all about, making those links with different constituencies, and then having those constituencies come together to develop global goods, and then work and support countries. So to close, my vision for working groups is twofold: continued focus on global goods, but with an increasing coordination and collaboration at country level, particularly bringing in our country-based, country-level research, academia, and technical groups to support the HDC across the world. Thank you.
So thank you to everyone on our last panel and for all of our panelists throughout the day. We'd like to end our time now as we began by hearing from the World Health Organization as well as a representative of Malawi's Minister of Health. Thank you. Go ahead, sir.
Well, good evening. Actually, I'm very happy to be here and to be part of this function event and represent the Honorable Minister of Health here in Malawi and the nation as a whole. So I should recognize the WHO, Director General, colleagues from WHO, implementing partners, countries of HDC and all the partners, distinguished ladies and gentlemen. Good afternoon. I am delighted to make closing remarks at this HDC leadership event. As you are aware, the HDC, established at a global level in June 2015, places emphasis on the measurement and accountability of results in health, with a strong focus on the alignment of systems around a single country platform. In this regard, in Malawi, we embraced the HDC in late 2015, establishing at the national level, and since then, the great strides have been achieved with support from both global and local development partners. Further to that, in Malawi, government endorsed the National Health Information Systems Policy, the Monitoring and Evaluation and Health Information Systems Policy, and their digital health strategy is currently at the final stages of drafting. As you may all be aware, in Malawi, we have introduced the National Identification System, currently covering 97% of adult population, that is 60 years and above. This is in order to take advantage of this development, and we have actually established the civil registration and vital statistics, which is also known as CRVS system, that has been introduced. And currently, in more than 583 health facilities across 28 districts here in Malawi, we are recording data using those systems, including beds. And actually, the efforts are underway to increase coverage of death registration. So currently, we have actually piloted in 120 health facilities in 4 pilot districts. We are exploring ways of revamping the National Identification System and CRVS to improve health service delivery. Our goal is to ensure that each client encountered in the health sector can be uniquely identified and offered quality services within the context of longitudinal patient care and continuity of care along health pathways. At the technical level, best strides have been made using systems along the central repository. We know it as DIHIS2, and Malawi has an approved list of national indicators in relation to health sector, and for which specific visualizers and dashboards are being designed in the central repository. We are aware that global initiatives by WHO, or the design of implementation of facility level dashboards to facilitate decision making at that level are being successfully translated into local context in Malawi. More recently, the master health facility list was released. This is not just a list of facilities, but a repository of critical information, a healthy facility. We have embraced the digital principles and are striving towards open standard, open data, open source, and open innovation. Distinguished delegates, ladies and gentlemen, although I have talked about highlights from Malawi, I am happy to note that all countries achieved remarkable progress as presented in this leadership event. Despite all the progress, all of our countries still have gaps in data analysis, interpretation, and use. Among others, we need to improve our technology so that it is better aligned and enhanced to push data instead of expecting an already constrained workforce to pull data. The national health indicators should be configured and made available through readily accessible dashboards. Departments, districts, and Local facilities should use data in a systematic and a routine manner to make key decisions related to the delivery of quality health services. It will be of great value to all of us in the health sector to have indicators on the national health policies and health sector strategic plans streaming on our computers or smartphones without us having to look for this data. On digital, our systems should be developed to ensure that the key beneficiaries of the solutions we deploy should be the patient and the care provider in the first place. What we do not usually see happening now is a systematic way of identifying working solutions and scaling this up to national level. Ministry of Health should successfully graduate from pilots to systematic scale up of tried, tested, and working solutions. With a view to reducing fragmentation and parallel systems, distinguished ladies and gentlemen, we are all aware that the core of the HDC initiative are the Sustainable Development Goals, which are intersectoral. In this regard, the strategies for data management and use be in the health sector should be intersectoral. Ministry of Health should look at intersectoral approach to data analysis, interpretation, and use. For example, data on weather pattern should be triangulated with disease patterns informing decisions in data in health sector. The country platform, therefore, should extend beyond monitoring health sector performance to monitoring intersectoral performance with the improvement of health and well-being for all people at all times. Finally, allow me to reiterate that all this can only work if we have functioning data and governance structures, systems, policies, and procedures in place. Distinguished ladies, delegates, gentlemen, I wish to thank you for affording me this opportunity to deliver closing remarks. I thank you for your kind attention. Thank you.
Well, thank you, Mr. Kambalami. Our last word of the day goes to the Assistant Director General for Data, Analytics, and Delivery at the World Health Organization, Samira Asma.
Thank you so much, and thanks to the delegates and the honorable ministers for gracing with your presence at especially a very important, addressing very important topic at very important time. Collaboration and partnerships are so crucial. I also want to thank all colleagues for a terrific round of dialogue and the ideas that you have shared with us today. I will begin my closing remarks with a quote from Dr. Martin Luther King, Jr. We may have all come on different ships, but we are in the same boat now. The beauty of this quote is that although we have different viewpoints, interests, strengths, advantages, but we are all navigating towards a one North Star. And that is making a measurable impact in the lives of people we serve. And indeed, here today, the Health Data Collaborative anchors us all together towards a common goal. Our goal is about serving people by using data to improve health for everyone, everywhere. Data helps us to identify gaps in health outcomes, address disparities and inequalities, and engage us all in a very strategic, thoughtful policy dialogue that we all move together to address the data gaps now and not wait for another 9.5 years until 2030 agenda time ends. But we should be all focusing on using data to make progress towards the promises that we have set for ourselves. We all agree, though, that truly accessible, real-time, trusted, and actionable sources for the full breadth of data simply does not exist yet. But we believe that the support that has been exhibited, the ideas that have been generated, and the contributions and the innovations that we heard from partners and countries, we truly hope that the Health Data Collaborative is now uniquely placed to accelerate this momentum. And this is especially crucial now as we refocus to rebound from the impact of the pandemic and the crisis, so that we can ensure a very steady progress that is sustainable beyond a one-time response. I would like to thank the growing circle of the Health Data Collaborative members. We now have over 50 partners, including governments, multilateral organizations, civil society, philanthropy, academic institutions, private sector, and most importantly, the SDG Global Action Plan partnership, the multilateral organizations, all moving together to be aligned as we respond to the country needs. And we hope that the Health Data Collaborative really helps ensure the very diverse perspectives will guide our approach in identifying and solving challenges and supporting and sharing best practices and solutions in a truly collaborative way based on mutual trust, transparency, and partnership. I would like to take a moment to acknowledge that this event would not have been possible without the person who has been behind the scenes, and you know him and his team through your close exchange over the past 12 months. And this is my colleague and friend, Craig Burgess, and his team, Moenia Kasonde and Nicole Sheg. WHO is truly humbled and honored to serve as the Secretariat for the Health Data Collaborative. And today we have set out a range of commitments through the Health Data Collaborative by keeping people and countries at the center. And the SDG Data Highway is a rallying call indeed to accelerate progress through increased alignment so that we reduce fragmentation, increase efficiencies, and have truly a stronger health information system that promotes health and save lives. The new Health Data Collaborative work plan that has been charted out with all the partners have clear milestones for 2021. And we hope that we will be reporting to each other the fulfillment of these plans and milestones that we have put for ourselves and hold ourselves accountable so that we can ultimately achieve the promise of SDGs. And finally, we truly look forward to continue working with everyone in this partnership and supporting as we all come together in our own efforts to implement the spirit and the vision of SDGs and health for all. Thank you again to our fantastic moderator, Catherine, for doing this very complex change of stars. So we appreciate you making such an impactful dialogue today. With that, I will pass back over to you, and thank you again so very much.
Thank you, Assistant Director General, for reminding us that different viewpoints can be a strength and not a weakness, and that we are all traveling on this data highway together. Thank you, too, for all those in the audience joining us today. We hope our event underlined the idea that data is indeed a public good, that we must address the gaps in data so that we leave no one behind, and that partnerships are essential to doing that. The HDC has an ambitious 3-year plan to meet these objectives. We hope you'll stay involved and consider joining the HDC if you're not already a member. On behalf of all of us at the Health Data Collaborative, thank you for joining us.